Johnson County Mental Health Center is teaming up with the corrections system to ensure residents get the help they need. On this episode, hear from those involved with the Reentry Project and learn about a new dashboard to track progress with this partnership.
Whether you live in or just love Johnson County, Kansas, JoCo on the Go has everything Johnson County. Here's what's happening and what's coming up in the community you call home.
Thanks for joining us for JoCo on the Go. I'm your host, Teresa Freed, a Johnson County resident and employee of Johnson County government. Johnson County has been really effective at addressing the needs of those with mental health concerns, especially when it comes to contact with the justice system. It's a leader in the nation with its co-responder program, which involves mental health experts teaming up with law enforcement to respond to calls. Another innovative program in the county is called the Reentry Project. Here to talk more about that are Brandy Kinney, Elizabeth Worth, and Mike Brower. I'll have each one of you introduce yourself, and if you could just talk a little bit about your role with the county, and we'll start with Brandy, then go to Elizabeth, and then Mike.
Hi, I've been with the Johnson County Mental Health Center for 8 years. I've done most of my time in the Emergency Services Division and working with the crisis team. I'm the newly hired team leader for the new reentry program that we're developing here at Johnson County.
All right, we're happy to have you. And Elizabeth.
Yeah, I'm the Director of Adult Services for Johnson County Mental Health Center. We have 2 years ago started the Justice Team as an addition to our adult division. And then this Reentry Project is yet another addition to our adult services. So we're really excited to have this program under our division.
Awesome. And then Mike, you're also fairly new to the county. So if you want to talk about your role.
Hey, Mike Brower. I'm the Criminal Justice Coordinator, which is a part of the county manager's office, but I serve the Criminal Justice Advisory Council, which is a council of our key criminal justice stakeholders and agencies that support individuals in our criminal justice system that meets regularly throughout the year to work on issues such as the one we'll be talking about today, reentry.
Okay, and just to start us off with about what is the Reentry Project? Like, how did this get started, and what does it involve?
So I can answer that. The program is specifically for Johnson County residents that are 18 years older who are either incarcerated at or being released from one of our Johnson County adult detention centers or the jail. So it could be the adult residential center, problem-solving beds that we have here at the county with corrections, or at our 2 jails. The key to this reentry project is that it's specifically designed to serve those with severe mental illness, severe emotional disturbance, or co-occurring substance use disorders who are re-entering the community. So the focus is more specific on the mental health and substance use piece.
And so can you talk a little bit about what that looks like?
Yeah, so I can take that question. So it's going to look like collaboration is going to be the key. This particular program, it fills the gaps that exist because of the way our systems are set up. There isn't necessarily a natural handoff, but we'll now be able to know when someone is releasing and immediately begin a needs assessment with them or service provisions with them. And so collaboration is going to be the key.
So it sounds like that screening process is pretty critical to identify what exactly those needs are, and then what sorts of services are offered.
Our goal really is to start working with people before release. And so with part of the collaboration that Brandy was talking about is we hope to identify these people even 60 days ahead of release so that we can wrap around our services and give them that support so that when they do release, they already have that support established and they're more likely to follow through. Those resources or those services that we'll provide will be case management, therapy, group therapy, medication management. We have a program in the jail and in the community called Medication Assistant Treatment, or MAT, and that's something that will be offered to these folks as well. We have employment specialists that will work with reentry program, assisted outpatient treatment. So as you can tell, there's just a large variety of services that these folks will be eligible for.
And so what's the end goal with this program?
The end goal with the program is the big end goal is we want to see reduction in recidivism amongst the community. And also some of our end goals are going to be, the quicker we can get involved with someone and be helping them with some of the concerns they might have, we're going to hopefully see, that there's not a continued stay in the legal system, that we're managing their mental illness, that maybe we're seeing a reduction in substance use because of the role that we're playing with individuals reentering into the community.
And so it probably seems pretty obvious, but I mean, this benefits the individuals, of course, but how does it benefit our community as a whole?
The biggest benefit is that because recidivism is such a big issue, it's costly to the taxpayers. There's more people in jail with severe mental illness than there are in psychiatric hospitals. So we know that it's not the right place for people to get the support they need to manage their mental health. So overall, you have a community that's healthier if you can reach out to people, provide them service, and get them connected to those things. We will teach people skills to help them navigate the complicated systems that they have to navigate. Help them learn coping skills to manage their mental illness. So we want them to be able to come back in the community with access to care, with employment opportunities, with insurance benefits, family supports, mental health, substance use treatment, all of those kinds of things that we would all want.
And what are some of the risks involved when we don't have this kind of intervention? So both to the individual and then also, family, and then just, law enforcement or people out in the community.
I think some of the risk can be like that again, that continued stay within the legal system, the continued pressure on family members when you have someone that is releasing, but is releasing with no resources and no help or guidance for that individual. It will help them reintegrate back into the community better with employment, with housing. And then of course, when individuals are having some of those needs met, then their social interactions are going to increase as well, like with their family members. That would be a hope. And so that would be some of the risks that we're seeing that we hopefully would see that would reduce being involved in the program.
And Mike, this is a topic that the Criminal Justice Advisory Council is very much interested in. So can you talk about what are the discussions happening and who are the players interested in this?
Yeah, so we have quite a few agencies that are interested in this. Of course, the Sheriff's Office, as caring for people with mental health issues or substance abuse needs in the county jail. It's difficult. It's expensive. The staff, although they get a fantastic amount of training with the Johnson County Sheriff's Office, they still aren't as equipped as professionals like Brandy and Elizabeth are to be working with these folks. And so, and then also our mental health partners, Johnson County Mental Health, that if they know someone is in jail and they have the opportunity to intervene with initiating treatment services while they're there, make sure they're stabilized, and that plan that started in jail can continue into the community, that makes it easier for them to serve this population. You think about our judiciary, they don't want to see people fail in the criminal justice system. They don't want to see people miss court. Our judges care very much about people having an opportunity to be successful. And then finally, our probation departments. We have found that people with mental illness or co-occurring disorders are less likely to be successful on probation. It's one of the reasons why we've embedded Johnson County mental health staff in our probation department. We have supportive agencies as a part of our council, such as InCircle, who works to help get individuals like this employment. Agencies like United Community Services that are working with us as well to make sure that people have opportunities for housing. And so, this really is a passionate issue amongst the council. And reentry has been a constant conversation for the council since its inception 13 years ago.
All right, great information there. And I do think we need to take an opportunity to kind of dispel some myths. I had the chance to sit in on some of the co-responder training a couple of years back, and I think one of the things that they addressed was this perception that people who have mental health concerns are sort of innately dangerous or unpredictable. And really, what we're talking about here is addressing their needs so that to eliminate that stigma, of course, but also to create this environment where they can thrive. So can you talk about that a little bit?
So yeah, you're exactly right that, through that program, we destigmatize the sort of violence that's associated sometimes with mental health. And so, we approach our work with people as their people, and we start with their strengths in mind. That's the philosophy of our agency, Johnson County Mental Health Center, and it always has been. So we really work to build on people's strengths and use their strengths to kind of guide their journey and their recovery. The recovery is our focus. And so people have a lot of skills and abilities, and sometimes they just don't know the right place to put them. So we kind of help them identify that.
And can you talk about some of the success stories that you've seen with this program?
So this program is actually relatively new to this, to Johnson County Mental Health. I'm hopeful that we'll see some of the same success stories that you've mentioned, our co-responder partners there. We have seen success there with fewer hospitalizations, fewer individuals being arrested and taken to our county facilities. That's the best scenario for the individual that we're dealing with, but it's also best scenario for the community. It's a cost savings program. So hopefully we'll see some of those same success stories. In the communities where they have done reentry, they do have success stories to go on with their program as well. So we're hoping to have the same conclusion here.
And tracking some of the successes of the program is important for a multitude of reasons. When we talk about how we invest our dollars in programs and services, that's really key. And so, Mike, do you want to talk a little bit about this new dashboard that will kind of take a closer look at some of that?
Thanks, Teresa. I'm really excited to talk a little bit about the dashboard that we'll be launching here next week. But this dashboard came about because Johnson County is a founding member of the National Stepping Up Initiative. This is an initiative to reduce the number of people with mental illness in jails. It's sponsored by the American Psychiatric Association Foundation, by National Association of Counties, and by the Council of State Governments Justice Center. In 2018, Johnson County was named a National Innovator County, one of 7 counties across the nation to receive that distinguished designation. And as an innovator county, we are challenged and asked to lead the more than 600 counties nationally who have joined this initiative. And about a year ago, Stepping Up launched a new initiative called Set, Measure, Achieve. They wanted us to set goals for reducing the mental health population in our jails. They wanted us then to provide measure. So that's the dashboard I'll be talking about. And then to show that we are able to achieve these goals through initiatives like co-responder and reentry. And so it's taking some time to put this dashboard together. There are 4 key measures that Stepping Up wanted us to report out on. One is the percentage of individuals with mental illness being booked into jail. The second is when they're booked into jail, how long do they stay? So the length of stay. The third is, do they come back to jail? So we're looking at what we call recidivism. And the fourth is then, do they get connected to care post-release from the detention center? And so, thankfully, through the work of the Sheriff's Office, Johnson County Mental Health, and our county GIMS department, our jail management system, they've actually been tracking a lot of this information for 4 years. And so it was a matter of aggregating the data, developing a dashboard, and releasing it publicly. And so, we'll be doing this next week. I do want to point out to as a way of showing some appreciation to our partners that Johnson County will be one of the first 5 or 6 counties nationally to release this dashboard, and will be the first county that actually can show connection to care through a connection between electronic databases, which is very important. And this data has already been utilized in decision making for the county. One is after about a year of collecting this data, the sheriff's office and the mental health center decided that they wanted mental health staff providing those services in jail, so that we had that direct connection to our community. So that changed in January of 2020. And then this data was actually utilized in the grant application with SAMHSA for the reentry grant. So, and now by displaying this information publicly, we'll be able to, as partners in this work, be able to refer to that data, be able to at any time see what our progress is, or see opportunities where we need to make improvements, such as how did COVID impact people with mental illness in the criminal justice system? We're going to be able to see these type of trends in this data set. And so we're very happy to share this with the community. And I just want to thank all the partners for the lot of work to get this done.
All right, great information. We, of course, look forward to releasing that to the public and getting some good feedback on ways to enhance that data and use it in various ways as decisions continue to be made. So anything else to add about the Reentry Project, Brandy and Elizabeth?
I think we're just excited to get this off the ground and watch it grow. Mike mentioned the connection to care piece of one of the 4 data points that we're collecting. I think we're going to see a huge shift in the amount of connection to care with this Reentry Project. And really, from that, we'll see a lot of success from the program.
16 years of working in jail, we have found that when people come to jail, they get stabilized medically. We make sure we take care of their needs. For mental health symptoms, we make sure that we address those. They become sober because they're not able to abuse substances. And they have a lot of time to sit and think. And so their motivation for change is never higher than when they are in our detention center. And so that is why, from a resource standpoint and from a financial standpoint, the best opportunity is to introduce services like mental health reentry program to individuals when they are at their highest state of readiness for change. And so that's what we'll be looking to do. And that I think will give us the best opportunity for results in working with people out in the community after they get released.
That's great information. And we, of course, look forward to the dashboard, but also the successes of the Reentry Project for sure. Thank you all for being here today. We really appreciate the collaboration, obviously, from Johnson County to make our community safer and to help individuals in need. We will have links to additional resources available through Johnson County Mental Health Center and also that dashboard once it's released in the show notes of this episode. And thanks for listening.
You just heard JoCo on the Go. Join us next time for more Everything Johnson County. Have a topic you want to discuss? We want to hear from you. Follow us on Facebook and Twitter at JoCoGov. For more on this podcast, visit jocogov.org/podcast. Thanks for listening.